Good day, guys. Hope you're having a nice time. We on to the next question on physiology, and this question, students in an examination hall were asked what okay, yeah, students in an examination hall were asked to define autoimmune diseases, okay, and also talk about two types of autoimmune diseases, all right, and of which I saw this question and I saw the need to just talk about the autoimmune disease and actually get to divide and the autoimmune diseases differently. Okay, so I actually made videos on them differently, just like five of them, right? So that it will aid instead of jam packing one thing in one video, okay, making the video reach 25 minutes, an exam question, and making it look boring, okay. I actually get to divide everything, all right. So discuss the rheumatoid arthritis, all right. So now, first of all, from this image, what can we see, all right? You could see that, yeah, from here you could infer that, yeah, this guy's hand is like stiff, okay. Now, first of all, we see that it is swelling, pain, or stiffness in the joints of the hand, all right. Now, um, a warm feeling around the joints too, and there's deformities and contracture of the joints. There's weakness due to what? Anemia caused by low red blood cells, okay? There's nodules or lumps, particularly around the elbows, okay? And there's foot pain, bunions, hamatoes with long-standing disease, okay? And there's fever, there's cyst, and there's loss of appetite. All these ones are just like from this image, right? Let's get to see how this question was answered, all right? By these students. Now we see that rheumatoid arthritis is a disease, all right, and this disease is due to what? Chronic inflammation of the synovial lining of the joints, okay, and there's chronic inflammation of the synovial lining of the joints. Now, next you say that the synovium becomes thick, leading to the development of a swelling around the joints and tendons, okay. The synovium becomes thick, leading to the swelling around the joints, okay. That has to do with the inflammation of the synovial lining, okay, synovial lining of your joints, right. Now, this thing gets inflamed, all right, and becomes thick, okay. Now it leads to the swelling, all right, development of swelling around joints and tendons, okay. And this is a rheumatoid arthritis that we are talking about, all right. You could see how your synovium gets inflamed. Okay, it gets inflamed and your joint around it is so thick. Okay, now we say that the characteristic symptoms are pain and stiffness of the joints. Okay, now um, the chronic inflammation occurs due to the what? And continuous production of auto antibodies called what? Rheumatoid arthritis factor. Okay, this inflammation is maintained, and this is due to the continuous production of auto antibodies. All right, and these auto antibodies are called what? Rheumatoid arthritis. Of course, you know that autoimmune disease is like the body attacking its own cells, all right. So these are the auto antibodies in rheumatoid arthritis that cause the inflammation of the synovial lining. Okay, now you can see all these red spots that we have here, all these red spots that we have here are actually joints, all right. And this is possibly where rheumatoid arthritis inflammation can occur. Okay, and now these are the various symptoms. Okay, numbness and tingling in hands and feet, joints feel warm to touch, right? There's disrupted sleep, there's low grade fever, there's fatigue, there's depression and mood changes, there's dry eyes and mouth, there's weight loss, right? Yeah, there's joint pain, swelling and stiffness are often symmetrical. Also, pain often starts in the fingers and toes and spreads to the other joints. Joints look red and discolored too. There's also pain in the big toe. Okay, and that those are the symptoms that we have from the picture. Let's try to see what was said in the examination hall. Now, symptoms of rheumatoid arthritis, all right. Rheumatoid arthritis primarily affect joints, but it also affects other organs too in more than 15 to 25 of cases. Now, associated problems include what? Cardiovascular disease, then osteoporosis, right? That's when your bones density is reduced, okay? There's also interstitial lung disease, okay? There's infection, there's cancer, you feel tired, you feel depressed, you have some mental difficulties, and you have trouble walking. Why? Because your joints have been tampered with. I know that your joints are the main stuff that you use in walking, all right? Making your walking flexible and stuff like that. All right, so with these guys, we have answered our question, a physiology question, a potential examination question. That was the autoimmune diseases, all right? And see you guys in the next tutorial. Bye for now.